My name's Diane Goldstein, and I am one of the 2010 recipients for the University Research Professorship here at Memorial. My research over the years, it has been a combination of the different degrees that I have. My training was in religious studies initially, and then I went into folklore and did an MA and PhD in folklore. And so most of my specialized areas in folklore are belief studies. And in folklore we talk about belief studies as really being made up of research in folk medicine, in the supernatural, and in folk religion. I work in all of those areas, but I'm also a specialist in narrative and a specialist in applied folklore. Applied folklore is the application of folklore in problem solving, real life problem solving. And because of that, an awful lot of my work has been in areas of the application of folklore to issues in medicine, issues in legal culture, and the way that most particularly the way that rumor and narrative wraps itself around these major kinds of actions and decision making in those different institutions. And more specifically, my work has been on HIV and the impact of rumor and narrative on HIV in terms of individual patient choices, but also how communities receive people who are HIV positive, how culture deals with HIV, and how our medical institutions have dealt with health promotion relating to HIV, how they've dealt with quite sensitive and important issues like non-disclosure, and how culture affects those issues of non-disclosure or of the stigma of HIV/AIDS within the culture, within a culture. I've also, my most recent project is on maternal infanticide narratives and how those narratives affect legal cases, particularly how they affect the opinions of juries or the community or the media in the treatment of those cases, and sometimes how they affect actual legal decision making that places those people in jail and mental facilities and so on.